Welcome to the Laser Therapy Institute weekly podcast, the world's first podcast about medical laser therapy for healthcare providers. Each week we discuss the latest research, interviews with experts, and how laser therapy can enhance your practice. Now here is the founder of LTI and your host, Dr. Jason Roundtree.
Hello, and thanks for joining us on the Laser Therapy Institute weekly podcast. My name is Dr. Jason Roundtree, and today's podcast is a recording of a group discussion between myself and our other providers at our Montana clinic in discussing neuropathy and the way that laser therapy can work to address the symptoms of neuropathy, as well as the mechanisms of how laser therapy works with the mechanisms of nerve damage itself. It was a fun discussion, and I hope you can listen in and benefit. Any questions, make sure you let us know. You can email us, info@lasertherapyinstitute.org. If you're interested in the programs and learning more about how to treat disorders like neuropathy, you can also find more information on our website, lasertherapyinstitute.org. So I'm going to be talking about an article called Mechanism of Diabetic Neuropathy. Where are we now and where do we go? From the February 2011 edition of the Journal of Diabetes Investigation, which I have never heard of.
Can you believe that's 8 years old now, 9 years old?
Right? It seems like 2011 is not far in the past.
No,
Yeah.
it's not.
Well, article starts off with just a quick introduction. It says, peripheral neuropathy is the most common and intractable complication of diabetes. Prevalence ranges 7% within 1 year of diagnosis to 50% in more than 25 years from diagnosis. So most patients with diabetes will get it. But they do say that if you include patients with subclinical levels of neuropathic disturbance, then the prevalence might even exceed 90%. So most patients are going to have some kind of neuropathy if they have diabetes. And they go on to say, too, that the presence of cardiovascular autonomic neuropathy dramatically shortens patients' longevity and increases mortality. Cardiovascular. So that's an interesting, we don't usually think about neuropathy in terms of the cardiovascular effects, but it's not just pain in the fingers and the feet. So the reason I wanted to get into this one a little bit was just talk about kind of the mechanisms or how this works. So I'm going to get a little bit nerdy for just a few minutes, but yeah, I think it's important because I don't think any of us got much education on neuropathy in school. Almost nothing. So not enough for sure.
If you take 4 quarters of neuroanatomy, but no clinical information on neuropathy.
Right.
Yeah.
It's wild. So the vascular supply in peripheral nerves is sparse and blood flow is likely to be compromised and lacks autoregulation. This system makes peripheral nerves vulnerable to ischemia. So they don't have that easy feedback mechanism that you have in a lot of the muscles and organs for vascular control. It also says that innervation of the epineurial microvessels is involved in diabetes, resulting in impaired blood supply in diabetic nerves. So your blood vessels are controlled in most cases by nerve gates that will open or close those vessels as needed. And so these guys are saying that the innervation to those nerves, the innervation to the vessels that run to the nerves themselves, that's part of the problem that really complicates the damage in diabetic nerves. Endoneurial microvessels show thickened and multi-layered basement membranes, cell debris of parasites, as well as disrupted endothelial cells, and thus constitute salient structural changes in diabetic nerves. So damage to the actual microvessels, also damage to the nerves that control those microvessels, which combines to damage the vessels downstream.
Right.
So also because of the structure of a nerve, where you've got a very small cell body, very, very long distance to the axonal neurites, so the distal axons are innately too weak to support themselves for the long transport of nutrients, nerve trophic factors, as well as other signals. Basically saying that if you damage those vessels that are feeding the axon itself, the cell can't continue to supply the rest of itself. Right. It's just too long. So that's why you can lose some level of blood flow to a muscle, but because it's so small, you don't have the same level of damage you do if you lose blood supply to a nerve. There's a lot of more information here. I'm not going to get into most of it, but it says this section is, how does hyperglycemia actually lead to peripheral nerve injury? Well, there's the polyol pathway, which is talking about the metabolic cascade. If you interrupt the metabolism of the nerve, then there's this whole cascade of factors that happen. Again, not going to get into that. But they go on to talk about glycation. So every component of nerve tissues can be excessively glycated in diabetic nerves. So deposition of those advanced glycation end products has been shown in every component of peripheral nerve tissues. And that exerts an injurious process in the endoneurium through direct toxicity to nerve tissues. So too much of those sugars produces these end products that are directly damaging and toxic to the nerves themselves. So that's one piece. Another piece is oxidative stress. So the generation of free radicals through that increased glycolytic process is a big factor. They do mention alpha lipoic acid in here, inhibiting neuropathy with antioxidants, because antioxidants are what really limit the damage that free radicals can do. So alpha lipoic acid has been used. They do say that hyperglycemia-induced mitochondrial changes include the release of cytochrome C. Now, with laser, we start talking about the activity of what laser works and how it works. We're talking about directly the activity of the mitochondria through cytochrome C oxidase. So if we can take this process, this oxidative stress process that's happening due to the hyperglycemic state, then you can reduce that oxidative stress by improving the function of the mitochondria, and cytochrome C oxidase in particular is directly stimulated by 800 nanometer wavelength, which is one of the big ones we use.
Cool. Is
Yes.
that directly on the side of the nerve that's and the tiny vessels?
Yes, but also upstream,
I was just going to ask.
which is why it's so critical to work at least above the level of injury, not
Right.
just at the level, but even starting at the cell body and coming the full length of the nerve. That's why those neuro programs can start in the spine and come all the way down the legs.
Okay.
Yep, exactly. That hyperglycemic state also results in reduced mitochondrial action potentials, and then poor energy synthesis of ATP. ATP is your cellular energy packets. If you don't have enough, the cell kind of withers away or cannot repair, can even die. So again, though, with laser, we're directly stimulating the production of more ATP, which allows us to kind of counteract that process. Talks about PKC activity, pro-inflammatory processes, trophic factors, a bunch of stuff we're not going to get into. Skip to the end. Okay. This is interesting because they start talking about, okay, in conclusion, what direction are we going for treatment? Well, alpha lipoic acid is really good for trying to prevent ongoing damage. We'll talk about that more in just a minute. But also, very recently it was shown that autonomic neuropathy in the bone marrow impaired activation and migration of endothelial precursor cells, which might determine the fate of vascular complications. Basically, those endothelial precursor cells are really important for blood vessel repair.
Right.
So if we're talking about blood vessels in general, I mean, this could have something to do with arterial hardening of the arteries as well. So they don't make that connection here, but it very well could be a factor there. So not just in the nerves, but even through that cardiovascular bit that they talked about in the beginning, the cardiovascular autonomic neuropathy too can be a big factor.
Huh.
So they also say that the vagus nerve, which conveys signals for regeneration of islet beta cells, may be disturbed in diabetic patients. So you can really end up, you can have a neuropathy even of that particular nerve that predates the diabetes, and then the diabetes just complicates that further once it gets started. So to conclude, they say neuropathy has long been regarded merely as a disorder of the most distal portion of the body, but the effects of hyperglycemia on the nervous system have now been shown to be a much more serious condition. Neuropathy itself is an important trigger for systemic abnormalities in diabetic patients. So, as we already know, critical to control sugar numbers. If you've got an uncontrolled diabetic, there's not even any point really in treating. I mean, we can get started if they will commit to getting their sugars down, but if they don't, we're not just talking about loss of sensation. We're talking about major systemic problems.
Okay, so just to be specific, he came in yesterday really flared up, and he's been flared up the entire time. And he absolutely, very first thing he said to me on his very first visit was, my sugar is not in control. So, and he told me yesterday, I'm skeptical. I don't think this is going to work. I've been here 5 times or whatever. I haven't noticed any differences at all. And so I was a little bit caught off guard because I hadn't really seen him since then. So I was like, humming. Anyway, but the more I thought about it, he really, just so anybody who sees him next, and I know it's a struggle. It's a real catch-22. He can't exercise because his back hurts. His back hurts because he can't exercise. The sugar's out of control. But if we can just pound that home on him.
Yeah.
And I think he knows it, but he's just frustrated because he just can't get there.
It's got to be very frustrating.
It's got to be. So, and he's a bright guy. I think he's...
Yeah.
He is.
Yeah. So, if we could just, whoever sees him next time,
We're
I'm
good.
sorry.
We're
We
good.
just need to continue to encourage him to get his sugar in control, and that will help everything. So,
Agreed. Yes.
just to...
Yeah, and it wouldn't even hurt to be like, hey, you can feel how bad this is in your feet. Yes, that's obvious. That's a big factor here. And back hurts and everything like that. But this is happening everywhere in your body.
Yeah.
This is not just happening down here. This is occurring to the nerves that go to your heart. This occurs to the nerves that go to your pancreas.
Eyes.
Eyes. I mean, all of this is very critical, and getting the sugars in control, we can work on you and we can get your pain levels down, but you are going to have a lot of ongoing problems that are going to come back if we don't get the sugars under control.
When you think about how much damage it takes to finally feel something, right?
Right.
When they finally started noticing stuff,
Mm-hmm.
like about really the damage that you can't see deeper, right?
That's exactly right.
Yeah.
Even in here, I gotta find it because exactly what you're saying. They talk in here about they would go in. They were doing testing where they'd go in and they would look at the nerves. Sorry, not the nerves, but the blood vessels that have been damaged, and they saw that a percentage with blood vessel damage had no neuropathy symptoms, and a percentage did.
Right.
But if they followed those patients, all the patients who had the blood vessel damage ended up with overt symptoms eventually. It happened. It was already going on, just like you're saying. It's just they didn't sense it.
It was brewing.
It was brewing, yep. Whereas the people who didn't have the blood vessel damage going on didn't end up getting symptoms. So we know there's subclinical levels that can be happening. The patient may not even be aware of it. So just because you started feeling diabetic neuropathy symptoms 6 months ago does not mean that it hasn't been going on for 5, 10, 15 years. So alpha lipoic acid, mentioned in the study. This is something that they have cleared for use in Germany via IV for neuropathy. Yes, we cannot do that here in the States. It has not been cleared. However, we can do oral supplementation, which is not quite as effective, but still has a lot of good benefits. This is an antioxidant. It's not a vitamin. It's not a mineral. It's an antioxidant. It's been shown to improve nerve conduction. It restores vitamin E and C levels in affected tissues, and it has protective effects on both peripheral and central nerves. So even with stroke, they've shown that it can help prevent damage.
And you're probably going to get into this, but when I do the day one, I never talk about specific treatments.
Nope.
This, nutrition, nothing.
Nope.
We just kind of enter them into the programs. But you go over this during your day two.
Day two.
Right? Okay, good.
Day two.
Because
Yeah.
I just want to make sure. I thought you did. But
Yes.
I didn't know if you were doing that because that was part of the plan or because that was something I was leaving out.
No,
You know?
that's it's too much for the
I
day
think
one.
so, too.
It's
I
just
think
too
so,
much.
too.
But
So,
day two, sit them down and say, "This is what we're going to do. This is what you need to take. This is how you need to eat."
Good.
That's the whole point of the day two, because by the time you get done with them, they already kind of know what we're going to be working on. They probably already had things explained well enough to them as far as how the process works, but we want to make sure that they're on the right page. This is where I do sometimes fall down, and I don't get people on enough of this stuff. I hate putting people on supplements. I really do. But there are times, like with some of this stuff, you have to have everything going in your favor or you're not going to make it. This is the R-alpha form. It's a little bit different format. This is the form that they use in Germany in IV.
Really?
Yes, there is just an alpha lipoic acid. It is not as effective from everything I've been able to see. So this particular form is the one we want.
It's R.
R-alpha. Yeah. So it's the only one we carry.
Okay.
But it's really important for that. B vitamins are the other side of nerve repair. So B6 is specifically for nerve coatings, myelin. You can overdose, so you can't have too much. You don't want to do too much of the B1. This is 5 micrograms. That's well within safe dosages. That's what I like about this one, is that it's got good amounts of Bs, but it's not those sky-high amounts that you'll see in like the Walmart brands. And this doesn't turn their pee bright yellow. So also B6 and B1 and B12 are really important for nerve metabolism in general, which if you're talking about nerve repair, you've got to have good metabolism in the nerves. This has good amounts of both B12 and B1, and then it's got that good amount of B6 as well. I misspoke, actually. It's got 10 micrograms of B6, which is still totally safe level.
Is that water soluble? Or
yes, okay. All the Bs are water soluble, so you can get rid of your extras pretty quick. And lipoic acid also, same thing.
Is it? Okay.
Yeah, short time window for effect. So you gotta a lot of times take it a couple times a day. Right. And you got to take it like every day. Yeah, and it doesn't build up in your system. The only thing is with B6, you can overdose. The body does get rid of it fairly quickly, but you can overdose and have some short-term negative effects, especially if you're on a very consistent high dose of B6. It can get kind of nasty.
What are the negative effects of B6?
They're just like the effects of not having enough neuropathy.
Oh, no, really?
Yeah. So there's some other things that go with that too. But most people are not on a super high dose B6 for a long period. You have to be on it high dose for a long period of time to really get into those side effects. And if you go off of it, it goes away pretty quick.
There's probiotics in it too.
That particular one does have some probiotics too, so it helps with metabolism, just the body getting the Bs in. So I really like this one. It's also really easy on the gut. So if somebody's got sensitive gut, that's why I carry this one. Is there anything wrong with people taking what they already have at home? No, that's fine. I'm not out here to get people to buy supplements. But if they're taking junk from Costco, sorry, it's probably not going to do very well. The last thing that I'll leave you with is that it's important on nerve damage to differentiate, at least in our minds, maybe even in the patient's mind, between you can have nerve damage and have a couple of different symptoms to go with that. One is nerve sensitization, where if the myelin's been attacked, the nerve is more sensitized. It's going to carry more signals than it should. That's the prickly, sharp, spiky sensations of pain that they'll get. But as that nerve continues to go under more damage, or as the axon itself takes damage, that's where you end up with numbness. You can totally have both. You can have one, you can have the other, you can have both. But as that changes, that's important to note, because somebody can go from numbness to just a pinprickly, sharp, uncomfortable sensation, and that's not very pleasant, but that indicates that the axon is healthier, even if the myelin hasn't caught up yet.
Right. Being stimulated.
So instead of the nerve just being deadened, now it's actually getting something, and so they're able to feel that. It's not fun, but it's an indicator the nerve's actually recovering, and it's short term, as long as we stay on gas.
Subscribe now to keep learning about the growing field of laser therapy. Check out our patient-focused podcast, Healing at the Speed of Light, a great resource for your patients. For massive practice growth and improved patient outcomes, become a certified Laser Therapy Institute clinic. Learn how at lasertherapyinstitute.org.